Yeah, I talked about the Cabana study, which has been a very exciting study for everyone involved in atrial fibrillation, looking at patients randomized worldwide between either catheter ablation or drugs, and then followed for a long time, many for 4 or 5 years, to see what the outcomes were. It's been a study that's been ongoing since 2009, so we've been waiting ages and ages for this data to come out. And although it was presented in abstract format back in 2016, it wasn't published until March of this year in JAMA. And it's got 2 papers, one looking at the clinical endpoints and one looking at quality of life. There's been a lot of debate about it as to whether it's a study that shows that catheter ablation really makes a big outcome difference for patients or not. But my take on it was that I don't think catheter ablation really changes the hard endpoints. And by hard endpoints, I mean things like mortality, strokes, serious bleeding, cardiac arrest. These things don't really change with catheter ablation compared to drugs. We do see that we can avoid patients going into hospital to an extent, and we reduce that. And we do see that patients have less AF, and most importantly, that they feel better. So the key lesson for me was actually in the second part, the second paper that came out from the study, which was the quality of life. Patients feel better after catheter ablation, and they feel better with ablation than they do with drugs. Now, that's the main reason that I do ablation. That's why I do ablation for patients, because I want them to feel better. And the really nice thing as well was that the patients that felt the worst had the most to gain. So when I see the patients who are really symptomatic, I know that with ablation, they've got a lot to gain. And that's where ablation really is better than drugs. This study is going to translate into UK practice, I think, importantly in the next couple of years, because as NHS England looks at what we're doing with ablation and how we're spending the money on ablation, I think it's going to look at us carefully in terms of which patients we're choosing. And with this evidence that these patients who are so symptomatic do so well, I think it's going to provide a good platform for us to say that these are the patients we really need to be treating. Cabana will never happen again. Because it took so long to recruit, and it was so disappointing in terms of its hard endpoints for the catheter ablation community to an extent, because we hoped that we would show that we really made a difference in big things like death and stroke. We thought we would change that for our AF patients with ablation. So I don't think Cabana will ever happen again. I hope that in some ways that it directs us to treat patients for the right reasons. And the right reason to use ablation is for symptoms. I think it's always been for symptoms, really. And although we do have a subset of patients where I think, which you never put in a trial, where I'm sure you do make a difference for mortality and morbidity, things like heart failure as well. These patients won't go on a trial. There'll always be the patients that you don't randomize. So I think we have to accept that we move ahead with clinical judgment for hard endpoints, not with randomized controlled trial evidence. I think that's okay, but recognizing that we can make patients feel better, which is often why patients come to us. That's why they come to see us, they want to feel better.